Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
Hi everyone, I am Dr. Bhavin Parikh. I am a ENT surgeon, otologist, and a vertigo specialist from Vadodara, Gujarat. And today I would like to give you some information about vertigo. Vertigo, as we all know, is one of the most common symptoms by which a patient presents to a doctor. It is the second most common symptom after headache for which patient present to doctor. And this vertigo can be caused by multiple causes, the most common of which is due to inner ear, which we are often calling as peripheral vertigo. So, and the other causes of vertigo are central vertigo or causes due to neurological disorders, and sometimes they are cardiac problems which can present as vertigo or dizziness, most commonly as a syncope. And some of the patient of vertigo presents as fall episodes. So coming to peripheral vertigo, which is my super specialty, subspecialty, peripheral vertigo is usually caused due to inner ear disorders. There are various problems which can present as vertigo. The inner ear vertigo is usually characterized by rotatory spinning sensation of the surroundings, and the most common cause for this peripheral vertigo is benign paroxysmal positional vertigo. So, in benign paroxysmal positional vertigo, the patient has the sensation of everything spinning when the patient tries to change the position of head. Most commonly, when patient is trying to get up from the bed or trying to go to sleep or looking up. So this is caused due to some otolith particles in the inner ear canal, which stimulates the sensor of the inner ear, also known as ampulla. So when this stimulation is there, patient will perceive it as vertigo. The most effective treatment for this benign paroxysmal positional vertigo, or also known as BPPV, is repositioning maneuvers. Depending on which canal it is involved, the posterior canal or lateral canal or superior canal, there are different positioning maneuvers. The success rate of such maneuvers is more than 90%, and the patient is immediately cured of the vertigo. So these patients usually don't require vertigo medicines, but may take medicine for 1 or 2 days to prevent acute symptoms. But these maneuvers are highly successful for complete cure of BPPV. The second most common cause of peripheral vertigo presenting to ENT surgeon, or one of the commonest cause of vertigo, is vestibular neuritis. This is caused due to viral inflammation of the vestibular nerve, which is the nerve which carries the information from inner ear to brain. And this is usually a seasonal disease, usually happens when the winter is going to start or at the end of winter, and presenting symptoms are severe rotatory continuous vertigo for more than 12 to 24 hours. Patient has very severe vomiting, nausea, and sometimes even diarrhea. These patients has to be treated by medical treatment, initially by suppressive vestibular therapy, either by cinnarizine dimenhydrinate or prochlorperazine for first 2 to 3 days. Once the patient settles down, then you have to start vestibular rehabilitation therapy as early as possible. This patient may also be given oral or intratympanic steroids, and this will make the episodes milder earlier. But the main therapy in this patient is again vestibular rehabilitation therapy. Is one type of exercises for compensating the affected nerve. The third most common cause is Meniere's disease, where the inner ear fluid pressure increases. These patients have episodic vertigo. They have vertigo for more than 20 minutes and up to 24 hours, which is again severe episode with initially with nausea, vomiting. But this patient even have some symptoms from ear like deafness or tinnitus or ear fullness, and these episodes subside after 12 to 24 hours, and these are paroxysmal attacks. So this patient will keep on having attack once every week, once every month, once every 6 months, depending on the severity. And these patients may require long-term anti-vertigo medicines like beta-histine and diuretics like hydrochlorothiazide and aldactone. Some patients, 5 out of 100, may not respond well to medicine, and you have to do ablative therapy in form of giving injections inside the middle ear known as intratympanic gentamicin, or sometimes rarely may require surgery, the most effective of which is vestibular nerve sections. So these are four common causes of peripheral vertigo. There are many uncommon causes like third window symptoms, but these four are common causes of peripheral vertigo. And I would like to end my lecture highlighting these four diseases: the benign positional peripheral vertigo, vestibular neuritis, and migraine. These three are the most common: migraine and the Meniere's disease. These four are the most common peripheral vertigo causes. Thank you.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.